Those carts are usually filled with trays and containers that has all the instruments in it. The knives, the scissors, the retractors, the forceps, everything. Come on in.
May Valdehueza explains how she makes sure thousands of medical instruments are meticulously cleaned and decontaminated, assembled, sanitized, then organized and stored.
When you talk about surgeries, you'll think like doctors, nurses, scrub techs, but before they can actually start their surgeries, they have to have the equipment. So if we assemble, we're gonna scan it.
That's her job as a sterile processing technician inside UC San Diego Health's Jacobs Medical Center. It's a role that's relatively new to her thanks to a special training program. Previously, she worked in housekeeping at the organization for the past 8 years and was looking for a change.
I want to go back to school and stuff like that, but there's no really time for it because first I'm a mom. I got to keep food and roof over the head of my kids, and I was a breadwinner for a long time. So like I have to choose between going to school or working.
She found something that let her do both. Valdehueza was part of the first cohort of UC San Diego Health's sterile processing technician program, which graduated 10 people earlier this year. They had dozens of applications.
So it's 18 weeks, 7 weeks at Southwestern College, so classroom training, and then 11 weeks of clinical training here at UC San Diego Health, and that was paid training.
UC San Diego Health's Monica Redmond says the program trains current janitors, housekeepers, and food service workers for new jobs in the clinical field.
We saw we had a high number of vacancies in our sterile processing tech department and, frankly, a lack of qualified applicants.
The program gives UC San Diego Health a wide range of skilled workers to fill those job openings, and the employees get paid to learn a new career.
So you can skip work and they'll pay you to go to school and to learn about this program. So I was like, oh, it's a win-win.
Valdehueza says the program has opened doors for further job advancement.
When we got here, it opened up a whole lot of possibilities for us. So that's probably the biggest advantages that I would say, but we also moved up a little bit on pay, on income and stuff. So I'm very happy about that.
The program is a partnership between UC San Diego Health and JVS Bay Area, a workforce development nonprofit. It's funded through a mixture of state and private dollars.
We're targeting incumbent workers, so folks who are already employees of UCSD, but who are in these jobs that don't really have pathways for growth.
Lisa Countryman Quiroz is the organization's CEO. She says programs like this one are meant for the many Californians who are in low-wage jobs and may have trouble paying for basic expenses.
Our focus is to help people who don't have four-year degrees, or other kind of certificates.
Jesus Delgado is another graduate from the first cohort. He also worked in housekeeping and said there were some similarities in his previous role to being a sterile processing technician.
I was working in the ORs, turning over the room before each surgery and getting it ready for the next surgery to follow.
While the training took place at the La Jolla campus, Delgado now works at UC San Diego's Medical Center in Hillcrest. He says the new role has reduced the number of hours he works each week from 60 or 70 to 40.
More importantly, I'm able to attend all my kids' sporting events, and they see the change as well. They're even more happier because I'm able to attend their practices or their games more often instead of having somebody FaceTime their game or something.
The program has already selected its next 10 applicants for its second cohort, which is set to kick off in January 2026. UC San Diego Health's Redmond said as long as the funding is there for the program, it will continue with the potential to expand to other clinical roles.
And this is ready.
Jacob Aere, KPBS News.